All right, good afternoon. It is 12:50 p.m. here in East Africa. We're coming to you live, and we will be looking back in the lesson that we had last time about the silent killer. And when I talk about the silent killer, I'm not quite talking about this cartoon that is, stalking you and is about to kill you, but it's something that is happening in your body, and we call it high blood pressure. And every time we talk about something being high, it means also that that thing could be low or could be normal. But today we're going to concentrate on high blood pressure. If it's normal, that means there is nothing wrong with you, and that's exactly where you want to be. And what is normal? We talked about that previously, but I just want to say if your blood pressure is normal, it should measure about 120 over 80 and below. So obviously it doesn't need to be too low, below 100, the top one. And there's a reason as to why we measure the top one and the bottom one. And it's actually very simple. The top one is the pressure in your blood vessels when your heart is squeezing, and the bottom one is when your heart is resting. Because believe it or not, the heart is always squeezing and resting, squeezing and resting. So that's basically why you have two numbers. It's when it's squeezing and when it's resting. So, but we don't have to consider so much. I want to jump straight onto complications of high blood pressure, and I will scroll down here to one of them, and this is heart failure. And the reasons why I would want to concentrate first on complications, because if you can understand exactly why you have certain diseases, because we treat them like they're separate diseases, but they're the same, so you can never go to, Nakuru before you go through Naivasha or around there or through Kijabi. So the reasons to why you get to congestive heart failure or simply heart failure, it is because of something that happened previously, and what it is that brings you to a place where you have a diagnosis called congestive heart failure. And this is high blood pressure or hypertension, or as we like calling it, the silent killer. The silent killer because your heart has been modifying itself as a result of high blood pressure, and you have no idea, there is no sign until it's too late. Once you start coughing or getting short of breath, which is some of the early symptoms, then it's kind of almost too late. So, but how do you get there? So when you think of high blood pressure, it is simply, if you think about a tire that is overinflated, there's so many things that could happen. It could burst, and which happens, in your body when it comes to blood pressure being high. But one of the things I want to talk about is the pump. When you have congestive heart failure, is because the heart has been pumping against pressure, and it thinks, just like the way I'll be lifting weights, my muscle think, for me to continually not get too tired and, so that I can get this guy strong, I need to actually get bigger. And that's what the heart, thinks, that it needs to get bigger for it to do what? For it to pump against the pressure, high blood pressure. And for the heart, that's not a good thing. You don't want to have six packs around your heart. That's a bad thing, because the heart starts getting out of shape. And out of shape, you look at, the heart here, it looks tired, because when if you've ever seen a normal heart, and obviously not a human being, even if it's a goat or a chicken, anything that you've slaughtered, it has a certain shape, and that shape we call it hemodynamic shape. So when your heart starts getting bigger because it's pumping against pressure, then it starts losing that shape. And when it loses that shape, what it means, it's unable to efficiently pump. And when it's not able to pump, guess what happens? Then any pump, whether it's water pump or fuel pump, whatever it is, if it's not able to push the fluid past the pump, then that fluid basically will start backing up from where it came from. And for the heart, for the most part, that blood is backing up to your lungs or to your legs. And that's a bad thing, because now your lungs are supposed to be like balloons, just have air, but now they have water. If you can see, these glasses have a little bit of water. And that means instead of your lungs filling, when you're breathing, your lungs filling in with air, the air finds water, and it's like, I want to get into the bloodstream, but I cannot, because there is water. Where did the water come from? The pump was not able to push that water away, which is part of the blood, and therefore start backing up into your lungs. Why did the pump do that? Because it got out of shape because of high blood pressure. I want you, I'm going back to see where this heart failure is coming from. It's coming from the fact that your blood pressure is high. So once that happens, the other place the water or the blood will start backing up is into your legs. And that's what you see. There's so many reasons why your legs could swell, but one of them is because the pump is not able to push blood and backs up into your lungs, and some backups into your legs. And when it does that, it's because when it does that, then you will start noticing that you're gaining weight because you're gaining fluid. And the issue here is not weight, because when you have too much water, then you start getting issues with electrolytes, and that means there's little elements in your blood now become too dilute because there's so much water. And what other things you start experiencing is shortness of breath. You're not able to breathe as normally. You breathe about 20 times a minute, but now because you have water in your lungs, you start breathing twice as much, which means now you're short of breath. Just simply taking a few steps, you start going like this. And when you're showing up in the hospital, you're sweating, not because you've been running, because you cannot breathe, because your lungs are full of water. And guess what? The medications that we give you, some of it will simply reduce that water from your system, because it's backing up and the pump is not able to pump that blood towards your kidney, so the kidney can get rid of it through your urine. So those are very simple things as I see them. We call them complications, but it's complicated because you do not know what is your blood pressure, because there is no sign. There is nothing. And people say, my blood pressure is high now because I'm having a headache. No. That's a late sign. If you're having headaches because your blood pressure is high, that's a late sign. That means you've had high blood pressure for a long time. So initially, when your blood pressure starts creeping up, you're not going to have any sign, and that's why we call it silent killer. So the reasons why I started today with complications of high blood pressure is because once you understand what is happening, let's scroll down here, or rather up here, and you see some of the things that could happen when your blood pressure is high. The pipes, are weak, and they start forming a little balloon, which eventually burst and start pouring blood into your brain, and we call it stroke. So I'll scroll again down here, and when it's happening in your brain, my friend, we call it a stroke. You start getting numb, paralysis on your arm, on your face. Now you're dizzy, you cannot see, you have trouble walking, you have dizziness. Why? All these things, they look like they're different, but they're symptoms. They're telling us there's something that is happening. But remember, the issue was not congestive heart failure. The issue was not brain having a problem. The issue was blood pressure. Blood pressure was the issue, that your pressure went so high. And how do you know? You can never know unless your blood pressure is taken. So today, do yourself a favor and go to some place, some clinic, some pharmacy. They take blood pressure for free. Rest for 5 minutes before you take blood pressure and have it taken. And if they tell you have high blood pressure, you need to listen to your physician. You need to go to the doctor. But majorly, it's not about medication. It's about knowing, where is my blood pressure? So if it's high, what we call prehypertension, and we'll talk about that later, and you can be able to bring it back down by simply modifying what you eat and how you live, meaning exercising and walking and running, riding your bike. And simply, that becomes your medicine. And over a period of 6 months to a year, like this guy talking to you right now, your blood pressure will become normal. He used to have high blood pressure when he was 20, and simply all that he did is walk, run, ride bike, skate, and blood pressure is normal. So again, we'll talk to you next time about other complications of high blood pressure as you go back to know what is normal. But for now, my name is Robert. Nice talking to you, and have a good time. God bless.